Well, good afternoon, ladies and gentlemen. Thank you all for joining us this afternoon. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today by Commissioner Jeanne Lambrew, Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrew and I are joining everyone today to provide everyone across the state an update on the COVID-19 situation for today, Wednesday, June 10th, 2020. I'd like to provide a couple of remarks on where things stand before I turn things over to Commissioner Lambrew for some announcements and discussion around the state of mental health preparedness and response activities in connection with COVID-19. Overall, the Maine CDC is reporting 2,637 cases of COVID-19 statewide. That's an increase of 31 cases since yesterday. Of those, 2,350 are confirmed by laboratory tests, and 287 are probable cases. 303 individuals have been hospitalized at some point during their illness with COVID-19. 100 individuals have passed away, which is the same number of individuals as yesterday, and a total of 2,023 individuals have recovered, an increase of 31 recoveries since yesterday. Of our cases, 650 have been among healthcare workers. Overall, since beginning our activation, Maine CDC has fielded now 8,637 consults from healthcare providers and members of the general public across the state. I'd like to provide a quick update on two of the outbreaks that we have been focused on and more actively engaged recently. The first is at Nicholls Manufacturing. We have had a number of productive conversations with the management there, and they're in the process of arranging and undertaking universal testing of all of their employees. Also, at the Abbott Laboratories facility, similarly there, Maine CDC epidemiologists and disease investigators have been working with the company, again, to take a look at things like workplace schedules and traffic flow patterns to see who individuals who have tested positive may have interacted with, to make sure that they've got the appropriate public health recommendations on hand, and also keep an eye out for potential patterns of disease transmission within the facility. Our investigation into both of those facilities is ongoing, and as we learn more, we will definitely keep everyone updated. Overall, Maine CDC is continuing with our efforts to push out PPE as well as viral transport media and nasal swabs to healthcare providers across the state. We also are continuing our work with our colleagues at the National Guard. Thus far, the National Guard, as of today, have fit tested more than 2,000 healthcare workers across the state in order for them to use the N95 respirators. These are the masks that we know can keep healthcare workers safe while they are working in hospitals, long-term care facilities, and other locations taking care of Maine people. Our colleagues at the National Guard have, over the past several weeks, undertaken these missions to make sure as many healthcare workers across the state can receive fit testing so they can continue working in their jobs on the front lines, taking care of Maine people. Before I turn things over to Commissioner Lambrew today, I'd like to take a moment to offer some thanks and gratitude to a couple of groups that we've been working with. The first is to our friends at the government of Taiwan, as well as to the people of Taiwan. Not long ago, the Taiwanese consulate reached out to Maine CDC, as well as our colleagues at the Maine Emergency Management Association, to offer us a very generous donation of 30,000 N95 masks. We were delighted to receive this donation, and I'd like to take a moment to officially thank our colleagues in the country of Taiwan, the people of Taiwan, and the representatives of the Taiwanese consulate for this very generous donation of N95 masks. As I mentioned a moment ago, these masks are critical to allowing healthcare workers across the state to continue their work on the front lines, keeping people and patients in Maine safe and making sure they are getting the healthcare that they need. We'd again like to officially thank all of the members of the Taiwanese consulate for their generous donation and for this outreach. We are very appreciative for this. But as we've talked about, N95 masks are only as good as a healthcare worker's ability to use them. And as we've discussed, in order to use an N95 mask, a healthcare worker has to be fit tested. Early on in the pandemic, one of Maine CDC's top strategic goals was to fit test as many people, as many healthcare workers as possible. But immediately after we set ourselves to that goal, we ran into an issue that our colleagues across the country ran into, which was that the solution that is needed in order to complete the fit testing process was at a premium. In fact, it was more than at a premium. It was just downright impossible to come by. This solution is sprayed into somebody during when they put a hood over themselves. And the solution is sprayed around them. And it's a bitter tasting solution, a bitter smelling solution. And when we talk about fit testing, what we mean is that after you put your mask on and you put the hood on, the solution is sprayed around you. And if you can smell that bitter solution or taste that bitter solution, we know that the fit testing isn't quite yet there. We know that because it means that the solution was able to get into your mouth or into your nose. And so the person doing the fit testing goes back and tightens it up. That solution was at a premium. It was downright impossible to come by. We were facing a challenge because we wanted to get as many folks fit tested, but couldn't find the solution. In fact, we even reached out to our colleagues at FEMA, and they themselves said that they were not able to obtain it. Thankfully, about 2 months ago, we received an outreach from Professor Karen Housknecht at the University of New England School of Pharmacy. She reached out to us and offered to make this solution for the state of Maine so that Maine CDC and our colleagues at the National Guard could properly undertake this broad mission to fit test folks. Over the last 2 months, Professor Housknecht and her colleagues at the UNE School of Pharmacy have provided Maine CDC with roughly 500 bottles of this solution. The provision, this generous donation, manufacture, and provision of this fit testing solution played a humongous part in our ability, as well as the ability of the National Guard overall, to fit test now over 2,000 people across the state. In addition, we've also supplied this solution to counties and their emergency management agencies who have requested it, so county-level fit testing missions can also occur. To give everyone a sense of how difficult this solution is to get, when we set this strategic goal for ourselves back in early February, we ordered a box or two of it from our standard supplier. That was back in early February. That order just arrived last week. Had we waited for our standard supply chains to deliver this fit testing to us, we would be 4 months behind in our work. But instead, thanks to the generous manufacturing, thoughtfulness, and donation from our colleagues at the UNE School of Pharmacy, in particular Professor Housknecht, we've been able to continue that mission and help achieve our strategic goals. There's one more group of folks that I'd like to thank today. This is a group of individuals who you see every single day. This is a group that allows us to make sure the public health messages that we've talked about at these briefings every single day for the past few months are able to reach as many people as possible. There are two people that you see every single day, but I'd like to also talk about the ones you don't. The first let's start with the two folks that you see every single day, including one who's with us here right now. Those two folks are Joshua Seal, who's our interpreter today, and Dr. Reagan Thibodeau, who is the interpreter you see when Josh is not with us. I'd like to take a second to highlight the work that they've done and personally thank them for helping us get these vital public health messages to as many people across the state of Maine during this critical time. Both Josh and Dr. Thibodeau are both born and raised in Maine. Josh is from Androscoggin County, Dr. Thibodeau is from Cumberland County. They've both been working as professional interpreters for years and have experience working both in the public as well as the private sector. They shared with us that this experience of being live on camera, live interpreting these broadcasts, has been a new experience for them. Frankly, Josh, I'll tell you, I think it's been a new experience for all of us. But I'd like to take a second, not just for the help that you've provided in helping us get our message to as many folks as possible, but also thank you and Dr. Thibodeau for your tireless work, your flexibility during these challenging times, and frankly, your willingness to just roll with it when things were changing in real time. I personally thank you for both of those things. Now, Josh and Dr. Thibodeau are the two folks that you see, but it's important for everyone who's watching to know that there's a large team of individuals that are behind the camera supporting them. These folks include Maura Nolan, Kristen White, Eva Hellewell, Elaine Williams, Grace Cooney, Lisa Traynor, and Amanda Eisenhart. They, in turn, are supported by an entire team at the Pine Tree Interpreting Services. So on behalf of myself, Commissioner Lambrew, and all of the folks who have been on camera with you, we'd like to thank you for your efforts and again, making sure that our vital messages during this time are able to reach as many people as possible. So thank you, Josh, and thank you, Dr. Thibodeau. With that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Dr. Shah, and I'm going to add my thanks. Our interpreters are those voices to many of the people in our community who really enjoy as well as learn from these folks. So I am pleased to announce that the Maine Department of Health and Human Services will use a new nearly $1 million federal grant to help Maine people cope with the psychological effects of the COVID-19 pandemic. Maine will use this funding to provide both direct support for individuals exposed to the virus and proactive outreach aimed at reducing the long-term behavioral health impacts of the pandemic. Mainers are increasingly reaching out for behavioral health support in the face of the pandemic. For example, Maine's Intentional Warm Line, which offers non-crisis peer supports to adults, has received more than 6,000 calls since March 30th, an increase of 40%. The call duration increased as well by over 60% during the same period. The department will use this $989,045 grant from the U.S. Substance Abuse and Mental Health Services Administration for 3 activities. The first is to offer crisis counseling to individuals diagnosed with COVID-19, close contacts of such individuals, and people living or working in an outbreak setting. Community health workers will be trained to provide psychological and emotional support, assessment and case management, and facilitate connections to Maine CDC contact tracers. Behavioral health providers will stand ready to offer additional support to individuals with more significant psychiatric needs. This work supplements the ongoing work of Maine CDC's Behavioral Health Response Team, whose trained volunteers have been responding to outbreak settings to help minimize the impacts and support those who are affected. Second, we are launching a public awareness campaign. It will offer information on expected emotional reactions to public health emergencies. It will help build resilience and coping skills. It'll help people know what warning signs to watch for and when and how to seek help. While the campaign will serve the general public, it will target those with pre-existing behavioral health conditions, first responders and healthcare workers, and those experiencing significant economic impact from the pandemic. Third, we are increasing support for the Maine Frontline Warm Line for first responders and healthcare workers. We also will expand support for the NAMI's Maine Teen Tech Support Line and the Intentional Warm Line. We're also adding psychological first aid as a service accessible through Maine's 211 system. We will also assess the behavioral health needs of different communities in Maine, including people of color, new Mainers, tribes, first responders, and healthcare workers to determine how best to direct future resources. We expect to apply for a second round of federal funding to extend the project over longer term, recognizing that public health emergencies have both immediate as well as long-term psychological impacts. We encourage people to visit the Maine Department of Health and Human Services Office of Behavioral Health for mental health and substance use disorder information and resources available during the pandemic, including helplines. That is, go visit maine.gov/DHHS to find how you can get more information and get help for any psychological, behavioral health, or substance use disorder needs. With that, I'll turn it back over to Dr. Shah for questions.
Great. Thank you, Commissioner. I'd like to just, before we turn to our colleagues in the media, provide a quick update for everybody on where things stand with testing volumes and that positivity rate that we've talked a lot about. Cumulatively, thus far in Maine, there have been a total of 69,588 tests for COVID-19 done. Of those tests, 64,411 have been the molecular PCR tests that we really focus on to tell us what's in the what's ahead of us as opposed to what's behind us. Of those molecular tests, 4.68% have been positive. Just in the past day across the state of Maine, there have now been 1,541 molecular tests that were conducted. Of those, 46 were positive, bringing yesterday's point positivity rate to 2.99%. So cumulatively, our positivity rate has been 4.68%, and our point positivity rate yesterday was 2.99%. So with that, we'll turn things over to our colleagues in the media. Today's first question goes to Eric Russell from the Press Herald.
Good afternoon, Dr. Shah, Commissioner Lambrew. Thanks for taking my time. I have two clarifying questions and then a new question. I want to clarify the zip code data that's up on the website right now. Yesterday afternoon, the data was posted as of June 9th, but then it switched back to June 2nd, and this morning it's June 7th. So I'm trying to get some clarity on what's happening and also what the plan is for that going forward.
Sure. So as we go through and update the data files, we like to make sure that they are as of the last time the data file was updated. If we find errors or if we find inconsistencies and are cleaning up the data, we revert to the prior time the data was posted. Eric, we'll get you some more clarity exactly around that, but it's entirely a function of, okay, we found an issue here with, say, data suppression and privacy in this zip code. While we address that, we'll go back to the previous data set that existed. So that's why the dates shift from time to time. Rather than taking down the entire thing, we just revert to the last update. Yep.
The other clarification I had was something you said yesterday, Dr. Shah, about not testing congregate care workers until you're sure that they have replacements lined up for any sick people. Can you expand upon that a little bit? Does that mean you're not going to test unless you know people are, there's replacements for those workers?
No, it's. I'm glad you raised that, Eric. So the context here is that as we move forward with testing individuals, say, who might be staff members at long-term care facilities, a long-term care facility has 100 staff, and we test all of them, and hypothetically speaking, 10 of them come back positive. Those individuals can't be at work. We'd like to make sure that the facility that in particular has a plan in place for how they will backfill those 10 positions, whatever they may be, before we engage in the testing. Now, it doesn't need to be a one-for-one. So it doesn't need to be that if Joe Smith tests positive, we're going to bring in Mary Jones. But we need to make sure that the facility has thought through the implications. So it's not as if we have to wait until there is a listed one-for-one replacement, but we'd like to make sure that we have a frank conversation with the facility before we start going down that road. They don't need to have every single position backfilled 4 or 5 people deep, but we want to make sure that they've at least got a contingency staffing plan in place before we go down that road. Commissioner, anything more to add on that end?
No, we continue to work with all of our different types of congregate living facilities with education, with support. We also have been working with different partners to figure out how we can make sure their staff support is needed. So we continue to value our partnerships with these facilities and look forward to continuing that partnership this summer.
It's not a hard stop. It's not a red light. It's more of a, we need to yield and make sure we think it through before we start.
Okay. And one more, if I may. So other states that have seen their economies reopen a little sooner than Maine have seen some noticeable spike in new cases. California, Texas, Florida, among them. If Maine is going to see a spike based on either the economy reopening or maybe some of these sustained protests or some combination of both, when would we see that spike?
Sure. Eric, it's as you can imagine, it's very difficult to speculate as to when we might see any type of change in the future with this outbreak. That being said, the states that you noted, as well as some additional states, Arizona and Utah, among others, what they have noted in connection with their statements around the increases they've seen is they've noted that it was not too far off of Memorial Day. So there is some speculation, and it's just that speculation, that it might be connected to those activities. What we know is that in any type of situation where folks are coming together, there's the possibility any number of days after that, anywhere from 5 to 20 or so days after that, for folks to become ill enough to seek testing, and then they'll have those tests reported to us. So there's not a certain number of days that we would look for in order to tie something to. We're always on the lookout for any increases, and then we look backwards to see what might have precipitated it.
Thank you both.
You bet. I'd like to turn next to Amy Brown from WERU.
Thank you. Just following up on that last question about the staffing plans, does that mean that someone who, you could have people who are potentially positive still working while you're waiting for a staffing plan to be put in place? And that, if so, that sounds like you consider understaffing to be more of a risk than COVID?
No, I wouldn't characterize it that way, Amy. What we want to do is make sure we balance both. So certainly if individuals are symptomatic, or if there's an outbreak in a facility, if there is a single case in a facility, we move immediately toward universal testing of everybody there, residents and staff alike. But in situations where none of the staff have reported any illness whatsoever, and there haven't been any outbreaks in the facility, then we have the ability to make sure before we go down that route that the facility has a plan in place. Now, it's important to note that many of these facilities that are licensed and regulated are already expected to have a contingency staffing plan in place per federal regulations. So for many facilities, this threshold has already been met. So those are the facilities that we've been starting to work with. And indeed, a number of them have already undertaken this exact type of resident testing across the state. As we work with more and more and more, we want to make sure that we have those plans and they're squared away. So no, it's not as if we value one over the other. We can do both at the same time. And as circumstances change, for example, after a single case, we immediately go to one, we immediately move toward testing.
Okay, thank you. And did Taiwan donate N95 masks to other states as well, or just Maine? And if so, why Maine?
I'm not sure the other states that they may have donated to, but we are incredibly thankful for their generous donation.
Thanks.
I'm going to turn next to Brian Sullivan at WABI.
Thank you very much. Dr. Shah, just a quick one for you and then one for the commissioner. Can you give us an update on the Chimbro outbreak and the contact tracing and just the latest there? Yep.
So the contact tracing has been underway. We have not identified any new cases associated with the Chimbro site. We'll get you the exact number. I believe when I looked at it last night, it was at 26 cases in total. We have not identified any further or subsequent cases. The contact tracing has been underway. And what we've really found is that many of the individuals who were affected happened to be from Maine itself. Another segment were from as far away as North Carolina and Wisconsin. One of the things that our epidemiologists have been trying to piece together, as we do with all workplace sites or workplace outbreaks, is whether individuals may have contracted the virus there or whether they may have all converged there, having contracted it elsewhere. Right now with the Chimbro site, given how large it was and the sheer number of individuals who are coming in and out, we haven't sorted that out yet, but that's one of the things our epidemiologists are working on.
Do you know how many days it's been since you've had a new case there?
I believe it's been on the order of 10 to 12 days, but rather than speculating, we'll get you the exact number, Brian.
Thank you. And Commissioner Lambrew, just with this new money that's being allocated and put towards mental health, why now? Why did we feel this was the time to roll this out?
So we're excited to just have received this grant from the federal government. We just got the award this week, and we plan to move out ASAP given the higher volume to our call lines, our helplines. We also have been concerned about some of the underlying trends and data that we've seen. So we've been looking at all of our different indicators. We do have a new dashboard that we posted on our DHHS website called COVID-19 Impacts on DHHS Services that includes some of the indicators that give us pause. So we're engaging with our community of providers to, number one, step up the counseling, number two, step up the education, and three, just remind people they can get help. We have resources for them. We have hotlines and helplines. We have one for teens. We have a special one for healthcare workers, the frontline, warm line. We appreciate that this is a challenging time for people with COVID-19, for their families, but also people in Maine who have been affected by the economic impact of COVID-19. We know so many people have struggled with teaching their kids at home or not having childcare or worried about their own jobs in their future, not being able to potentially get back into the workplaces that they want to, or vice versa, worried about going back to work. So we really urge all Mainers to use the resources that are out there. They're available online, including 211, for needs, for help as needed.
So this is new money separate from the, maybe I'm wrong, but the $1.3 billion that had been allocated. This is just new separate cash.
This is a new grant coming from the federal government to the Maine Emergency Management Agency that we're working with to implement this program. It is new funding this week.
Thank you.
We're going to turn now to Caitlin Andrews at the BDN.
Good afternoon. Thank you for your time. I have a question for Dr. Shah, then I have a question for Commissioner Lambrew. Dr. Shah, I was wondering if you could share your thoughts about what might have caused the MEMA building closure. I understand that some bacteria was found in the air humidifiers that I believe you guys are still testing, but not in the water and air systems. What are your thoughts on that?
Sure. So, Caitlin, our investigation is still underway. As you noted, we recently received results that suggested that the 4 humidifiers that were placed in the Emergency Operations Center itself did test positive for various bacteria. Now what we're working on is matching up the bacteria with the symptoms. Of course, not all bacteria cause the same symptoms. So we're trying to take a look, we are taking a look at the bacteria that were found and then trying to figure out how that matches up with the symptoms that people experienced, as well as their locations. Now, the ultimate question, of course, is what might have caused this in the first instance. That's, of course, the $64,000 question in any kind of environmental investigation of this sort. So we're looking at other hypotheses there. One, of course, is that these bacteria, some of them are naturally occurring in the air around us. They are natural, they happen to occur, but in certain situations, they can concentrate, and then if concentrated for a long enough period of time, can cause some folks to get ill. That's one hypothesis that we're looking at. We've also tested the water in the building as well as the HVAC systems, neither of which showed anything of concern. So we're continuing our investigation, but we found that the humidifiers themselves are likely the source of whatever propagated across the facility or within the Emergency Operations Center. And I'd like everyone to know that those humidifiers were immediately removed. They are no longer in the facility whatsoever.
Do you have any early guesses, like maybe like Legionnaire's or Pontiac's disease?
No, so that's one of the hypotheses that we're always looking at. Candidly, the symptomology didn't quite fit for something like Legionnaire's that usually causes a pneumonia. So we're looking at other bacteria that could cause more transient, rapid onset type situations. Those other diseases tend to cause smoldering, low-level infections that get worse over time and cause lower respiratory symptoms. The symptoms that most people experienced here were things like muscle aches and fever as opposed to cough and shortness of breath. So we're looking at some other bacteria right now.
Thank you. And for Commissioner Lambrew, I was wondering if you could tell us a little bit more about what the DHHS folks who will be returning to the remote offices, what some of the practices will the department be instilling when they return? And can you give us an idea of how many employees will be going back to those remote offices?
Sure. So this week, we are beginning to return some of our 3,400 Department of Health and Human Services workers back to the offices, including into the field for child welfare caseworkers. We are starting slow. There are 140 of our 3,400 workers who are coming back this week. That's less than 1%. We are still largely teleworking. So taking out Maine CDC and our hospitals, which have different types of work, we still have 86% of our workforce that are teleworking or dispatching from home. But for those who do come back to our buildings, we are taking the advice of our Maine CDC colleagues. Cloth face coverings are worn in the hallways, in restrooms, in elevators. We've moved tables out of any break rooms so people are not congregating there. We are maintaining the very good practices for cleaning and hand washing and personal hygiene. So we are taking the advice of Maine CDC and US CDC to make DHHS a safe workplace. But we also recognize it's important. We are entrusted at the department with ensuring that children are safe. So our child welfare workers need to be back on the job. We know some people need to meet in person to sign up for benefits or to understand a form that they got that's confusing. So we are safely returning to some of our functions in those areas where it's really important to people in Maine that we're there for them.
Thank you.
Thanks, Caitlin. We're going to turn to Steve Missler at Maine Public next.
Thanks, Dr. Shah. A couple of quick follow-ups on the Abbott Labs situation. You had mentioned that the CDC had discussed with them work schedules and traffic patterns within the facility, I'm assuming. I don't recall you ever mentioning that before in a workplace setting. Is there something going on there that's concerning that you would highlight that, or is that just sort of a general practice?
No, I'm glad you raised that, Steve. No, when we look at workplace outbreaks, one of the first things that we ask for after how many folks have been affected, how many folks work there, is what their work schedules were. And then if it's in a food processing facility, we ask for a physical map or a layout of the facility to see where in the facility folks were working. In this case, being partly office and partly lab space, we ask for maps around traffic flow and pattern. That is very standard practice in workplace outbreaks.
Okay. And then as it relates to the outbreak and testing for that, are they using their own tests, or are they submitting samples to the Maine State Lab? Out of curiosity.
They are undertaking testing on their own. I don't know exactly which tests they are using. They would be in a better position than I to answer that, but I do know that they are undertaking testing on their own, which is in keeping with the recommendations that Maine CDC offers in any workplace setting, which is to say, after a case is identified or an outbreak is identified, we recommend testing everybody. Of course, Abbott has already been doing that weekly since mid-March. They can use our laboratory or they can contract with an outside laboratory.
Okay, thank you.
Mm-hmm. I'm going to turn next to Megan from WMTW.
Hi, Dr. Shah. Can you just confirm how many cases there are at Nicholls Manufacturing? I think it was 7 yesterday. Has there been a change?
As of yesterday, Megan, that's the exact number.
Okay. And my other question has to do with Abbott Labs. So maybe just a clarification, really, but if there were roughly 23 cases since they started testing in mid-March, and then there were 5 that triggered the outbreak distinction beginning May 31st, there was, in that window between mid-March and those to May 31st, let's say, those 23 cases, there was never at any point when any of those cases were so close together that was it ever on your radar before?
No, the short answer is that it wasn't. As you're aware, it's a large campus, and they had been reporting those cases to us, but they had been sporadic and occasional cases that would be consistent with community transmission. What we've seen in the recent few days is that uptick. That's when the flag went up. That's when we decided to make sure we were taking that harder look.
Okay, thank you.
You bet. We're going to turn next to Bob Evans at News Center.
Hi there. Good afternoon to both of you. Good afternoon, Dr. Shah. I'm Don Kerrigan's understudy. Dr. Shah, there are reports that a person's blood type can have some impact on people getting COVID-19. Is that correct? And if so, what's your knowledge on that?
There have been some reports of that, but none of those at this time has been endorsed by the US CDC. And so really, it's one of those scientific questions that right now, the answer is not known. And until the US CDC endorses it and has reviewed the data and has made sure that it meets all their exacting standards for scientific accuracy, it is too early to tell and not something I would put stock in at this time.
Okay. And my next question is, now that things are starting to open up, what is the status of the contact tracers that you mentioned that will be hired?
Mm-hmm. So we've been continuing to add to our team of contact tracers. We can get you the exact number, but as we've identified more cases, we've been adding to our team of contact tracers in stepwise fashion. We've done that through two mechanisms. One is through hiring individuals. The other is through tapping into the robust base of individuals who have said they'd like to volunteer. And so as we've detected more cases, as we know that the contact tracing needs to improve, we've added to our workforce commensurately and in a stepwise fashion. We've also been making much more use of the IT tool called Sarah Alert that allows us to enroll individuals and keep tabs with them in a way that works for them, whether it's by phone, by text message, online, by an app, or not by an app, but online through a website. We've been enrolling more and more and more contacts into the Sarah Alert system over the past few weeks. That's been a great way for us to keep in touch with folks to make sure that if they're developing symptoms, we're aware of it and can get them help. Commissioner, is there anything else that you'd like to add on top of that?
Just that as we add testing capacity in the state of Maine, we also need to add contact tracers. As Dr. Shah has previously said, when you go test more people, you find more people with COVID-19, even if our rate remains constant. So we're going to continue to build that team because we know that in the summer, there are more people in Maine. So it's a prudent activity to both expand our testing as well as expand our contact tracing for the coming months.
Thank you both.
You bet. And the last question today goes to Joe from ABC7.
Thank you, Dr. Shah. From the beginning of the pandemic, the testing equipment for COVID-19 has been kind of scarce, and we've had, ups and downs through it. I've been talking to a lot of people in the hospitality industry, and many of them are wondering why the alternative to the 14-day quarantine was changed to a negative test, and the alternative given which states that's difficult to get for a vacation. And the question I have for you or for Commissioner is, what kind of input does the CDC or the DHHS have on those new policies that have been implemented for out-of-state travelers?
I think I'll begin by saying, Maine values its tourism industry. It's one of the major industries in the state. We know so many people whose livelihood is based in tourism. We also know those workers, those Mainers, want to have tourism be safe. Virtually every state with tourists like us has some version of 14-day quarantine because without a treatment and without a vaccine, there's few alternatives. What we chose to do in Maine is to say there may be an alternative to coming to Maine and quarantining for 14 days. That is getting a recent negative COVID-19 test that will allow you to not have to come and stay in your hotel room until you've passed that 14 days. Again, right now there's no tourism allowed beyond these 14 days in any New England states. We feel like we're giving our tourists an alternative. We also did announce that residents from New Hampshire and Vermont can be coming to Maine without a 14-day quarantine. They can come now as seasonal residents or people from Maine who go to these states and come back and not quarantine. Beginning on June 12th, hotels and lodging can have New Hampshire and Vermont residents check in. And beginning July 1st, when our own testing capacity is expected to significantly expand, hotels and lodging and campgrounds in Maine can accept people from states other than New Hampshire and Vermont with a recent negative test as an alternative to quarantine. So we're proud of this policy. We think it's going to allow people to come and safely vacation in Maine. And we expect testing capacity to expand in Maine and other states over time to make this a viable option.
The only thing I'll add on top of that, Commissioner, is that our goal through this has been, and this is what I believe we've done, is to add options for individuals rather than take them away. This is yet another option that a family can pursue if they'd like to come vacation in Maine, and that's the direction we'd like to head.
Yeah, and it will just add an even more viable option, because we really do think that this will allow people to come. We are hearing reports in different states that there is testing capacity, so we're optimistic that this offers a pathway for summer in Maine that people can enjoy.
Thank you very much.
Great. Thank you, Joe. And thank you all for your questions today. I'd also like to thank again Josh and Dr. Thibodeau for their tireless support of our efforts in communicating with as many people across the state. We really appreciate it. And I'd like to thank everyone for dialing in and tuning in today to hear the latest on the COVID-19 situation across the state. We hope that everyone has a good afternoon. We wish you nothing but the best of health, and we look forward to speaking soon. Thank you very much and have a great day.